graduated from the Medical College of Georgia down in Augusta. I was in the Air Force at the time, had a psychiatry residency lined up. Psychiatry, I really like it, but I got sick, I got medically discharged. Spent the last year doing clinical research down at Tulane University. And I really like academia, I really like teaching, so here I am in my wife's hometown, Oak Ridge. She's the one who's 38 weeks pregnant and trying to report me. So. If we have any questions, just feel free to holler them out, stop me. If anything you think of pops up. Just how prevalent drugs are in college campuses. This is from a survey in 2010 of college counseling center directors, representing about 2.75 million students in the nation. But about 24 of them being seen in the college counseling centers are also on psychiatric medications. 85% saying that number's going up, and it certainly is. The number was around 20% in 2003, 17% in 2000, 9% in 94. 13.6 of counseling center clients are referred to a psychiatrist for further evaluation. I don't know y'all's numbers, if that sounds right or not. But we're going to talk about what are the different types of mental disorders that we see. And of course, not everything gets treated with medications. How do we know which ones take medications, which ones don't? How do they help? What do they do? Are they really effective? Are they just placebo candy? Are they being overprescribed? When these students are on the medicines, are there things we should watch out for, things we should worry about? Especially, sudden withdrawal symptoms. It's not good for a student to just suddenly stop taking their medicine. It causes horrible side effects, plus it might be a sign of something else going on. And then, of course, what are some of the main obstacles these students are receiving against staying on the proper treatment? Medicine adherence is always a major problem. So this is the top 10 psychiatric disorders by age. You see 18 to 29, that's a good Pellissippi range, right? I want to say the average student age is 24 to 26, although I'm sure the median's lower. Major depressive disorder, number 1 in 6. You compare this to the lifetime prevalence. Alcohol abuse, much more common in our age group than the national. Social phobias, specific phobias, anxiety disorders, conduct disorder. It's usually something diagnosed in childhood. People carry it with them. Sometimes they grow out of it, sometimes they don't. Drug abuse, we certainly see that as well. Oppositional defiant. ADHD. That's probably the one most faculty are concerned with, right? Because this affects behavior in the classroom. Intermittent explosive disorder. PTSD. So this number is probably going up in this age group over the last decade. We'll see how it evens out. So, also the top 25 psychiatric prescriptions prescribed in 2011. This isn't specific to college students, this is just the national averages based on the number of prescriptions prescribed. Xanax, number 1. Everybody heard of that one? Yeah, it's not the kind of thing that you can use to actually treat or cure any mental illness. It's something that'll calm you down for tonight and then tomorrow you're still sick. But it's the number 1 thing being prescribed to people to help them out. SSRIs, very high up on the list. So these are probably the most common medications you're going to see, the SSRIs. They're great for depression, they're great for anxiety, they're great for long-term treatment. You've got to stay on them for them to work, though. We have other types of antidepressants, serotonin modulators, SNRIs, and DRIs we'll talk about. More benzos, antipsychotics at number 10. Anybody know the age at which people usually have their first psychotic break in schizophrenia? Early 20s. So on campus, right? It's very common. We'll talk a bit about schizophrenia. More antipsychotics. Adderall comes in at around number 15. More antipsychotics, more stimulants. So, how are these things diagnosed? And I know that psychologists have a different way to diagnose things than psychiatrists. There's usually a rivalry, but to psychiatrists, this is the textbook. This is a statistical manual saying if you have 5 of these 8 symptoms, odds are you have this disease. And they do that for every mental disease. There's over 400 of them. Possibilities. So you got to know how to use the book, you got to know how to look for these things. This is how they're diagnosed. The most recent one just came out last year, so I'm not well versed on the newest edition. But it's been around since the 70s. It's pretty well known. So everybody gets sad. Everybody gets anxious. What makes it into a disorder? Well, emotions and thoughts are normal. People have them, and it's okay to have them. But these things are usually transient. They're temporary. You feel better the next morning. You go blow off some steam and you get better. Also, they don't persist. They don't affect your work. They don't affect your school. They don't affect your family, your friends, your relationships. They don't interfere with your ability to sleep and feed yourself. Just those basic activities we do. But in mental disorders, they do. A disorder is something that's prolonged, severe, and it affects your ability. Depression, the number one cause of disability in this age group. People will stop coming to school when they get depressed. Disorders can also impair your perception of reality. And that's when you're talking about more of the psychotic disorders that are prevalent, and untreated depression and bipolar disorder turn into psychosis. So we have drugs and we have therapy, and what's the real difference besides the friendly rivalry? Drugs are scientifically more effective for the severe symptoms. Therapy is better for the milder symptoms. If somebody is mild, it is best for them to seek treatment with a counselor. If something severe, though, they probably need to take a medication to control those symptoms. Drugs have side effects. Drugs are toxic chemicals. Therapy doesn't tend to have any side effects. It tends to be harmless as long as you don't hurt their feelings. Psychiatrists spend less time with their patients as well. You've got to see 30, 40 meet quota number of patients a day, whereas a psychiatrist or therapist can spend as long as they really need to work through that crisis. They get to know the person better. And hopefully you see them more times than just once every few months to get their medicine refilled. The drugs, though, have more scientific literature behind them, mostly because there's more drug money to research, to fund these researches. The science behind psychotherapy, it changes every couple of years. What's effective, what's not. The efficacy is also more important, or more consistent with drugs. You know what you're getting, essentially. Psychotherapy is very highly dependent on the therapist. Different people do it differently. Cognitive behavioral therapy means something different to you, to you, to you, to how you do it, to how you interact, to how you make those behavior changes. Drugs are most effective when combined with therapy. Therapy is most effective when combined with drugs. When you add them together, they work synergistically. So that's really the goal in the overall healthcare model. Unfortunately, the system's pretty broken. People only usually do one or the other and don't like to get referred out for the help they really need. So the different types of disorders, we said that anxiety is probably one of the most common, Xanax being number one on the list, right? Mood disorders, like depression, bipolar. Substance abuse, we saw that was big, alcohol, right? Impulse control disorders, these are your conduct disorders, your bad kids. Psychotic disorders that develop in college-age students. And then, of course, your developmental disorders from childhood. The biggest one of those probably being ADHD in this setting. Usually if you have other things like autism, you can make it to college, but it tends to impair your social functioning, or your, intellectual functioning, to a level that it's hard to overcome, whereas ADHD can actually be treated with medication and bring you up to a normal level of functioning, so you're allowed to continue on with your education. So anxiety disorders. The worry actually overwhelms your ability to function. Everybody gets nervous, but you're so nervous you won't leave your house. You're so nervous you won't get in your car. You're so nervous you won't go grocery shopping for food you need. You're so nervous you don't show up to work. Very unpleasant. People will be depressed and just say, oh, well, I'm depressed. People with anxiety don't want to be anxious. So there's a lot of different types of anxiety disorders. Panic disorder, very common. People have panic attacks. Phobias, and these include things like fear of spiders and airplanes. These also include things like social phobias, being afraid to stand up and talk in front of a group of people, afraid to be seen in the quad with all the students walking around, afraid to be in the big open spaces. OCD is something that develops. PTSD, of course, an anxiety disorder more common than our veterans, perhaps. Generalized anxiety disorder, that's actually the number one most diagnosed thing in our age group, generalized anxiety disorder. And that's when there's not a specific thing making you worried, it's just everything. Oh, I've got to go get the mail when I get home, and then you obsess about having to go pick up the mail when you get home. Psychotherapy is the main treatment for these anxiety disorders. There are effective drugs. Xanax certainly helps anxiety. It doesn't fix the problem, though. They're really overprescribed. So mood disorders, number one cause of disability, like we said, they will cause you to stop bathing, eating, going to work. Leading cause of disability in college-age students. Some states will actually give you disability benefits for these. And the people who get disabilities for depression, they're depressed. They're usually in institutions somewhere because they can't function outside of one. Suicide, the number 2 cause of death in our students. So when we're actually talking about medical illnesses and things that would kill people our age, it's depression. Number 1 is accidents. Number 3 is homicide, usually. Alcohol's somewhere around 4 or 5. But it's suicide here that's actually killing people. And we pay less attention to this, though, than we do alcohol and other types of education programs. Bipolar mania, people who become manic like being manic. They can stay up for long periods of time. It's euphoric to them. They enjoy the experience. So they're less likely to want to seek treatment. Both depression and bipolar disorder, when they get severe enough, they do cause psychosis. Medications are absolutely necessary to treat these things, especially when it becomes too severe to handle. Suicide being a type of psychosis. I always think of the most primal urge in a person being the will to survive, right? You do anything to survive. You'd fight, you'd kill, you'd cannibalize people if you were trapped in the mountains. But these people have just completely lost that will to live. Just completely gone. But medicine fixes that. By giving somebody a pill, you actually restore that will to live. And it's a magic change. Mild to moderate depression, therapy is just as effective as antidepressants. Usually, antidepressants are 60% effective. Psychotherapy is 60% effective. When you use them both at the same time, 80% effective. So the best way is if we can combine these two treatments. Substance abuse. Abuse is you using something that's harmful. And this isn't just physically, it's also psychologically harmful. Dependence is when you're continuing to use the thing even after these negative consequences have occurred. You lost your job due to a DUI, but you're still drinking. Alcohol is actually more harmful to yourself and more harmful to other people than any other drug on the market. It also tends to be one of the most legal drugs out there, right? Compared to all the other substances you could possibly abuse. In college students, they actually believe that prescription misuse is a greater problem than alcohol, but of course it's underreported. Opioids, especially the painkillers, benzos, the Xanaxes we saw prescribed, and then stimulants, your ADHD medication. Anybody know the price of ADHD on this campus? Or, excuse me, the price of Adderall? It's usually like $5 to $10 a pill. Usually the first one's free. A lot of people just share them with their friends, which is fine. You get a 30-day supply, but only take it on the weekdays. Really, they'll help anybody who takes them. But the people who really need them, it just makes them normal. It doesn't give them superpowers, it just makes them normal. So here we see a big survey of a lot of drug abuse experts, harm that causes to you and harm that's caused to other people. Harm to you, yeah, ecstasy hurts you, but not really anybody else. As you get higher and higher up the list, though, alcohol, number 1, especially to other people. You're more likely to hurt somebody else on alcohol than you are yourself, which is almost worse, right? Hurt the people who didn't deserve it. Your impulse control disorders, these are things like your intermittent explosive disorder, oppositional defiant, conduct disorders. These tend to be your bad kids. They start out in school getting in trouble a lot. They'll often end up in juvenile corrections. Unfortunately, there's not a great treatment for this anyway. Therapy is thought to be more effective than medications because no medication is really effective at treating this. But even the therapy doesn't work that well. This is what comes on to become known as sociopathic behavior, antisocial personality disorder. These people tend to end up in prisons. The prison system being the #1 mental health care provider in the United States. People would rather fund prisons than psychiatric hospitals. State decision. Psychotic disorders. Things around you are not what they seem. Either you're having hallucinations, you're sensing sounds or sights that aren't there, or you're having delusions, fixed false beliefs. You believe the neighbor is trying to poison you, despite all evidence to the contrary. This happens with, like we said, with the mood disorders that go untreated. Also in schizophrenics, which 1 to 2% of the population, so Pellissippi is what, like 7,000, so that's at least 70 students. First psychotic break usually occurs in the early 20s, usually more likely in males. Psychotherapy is absolutely ineffective for this. These people need medication. Once you're psychotic, you've got to see a doctor. Developmental disorders are the ones that develop in childhood and persist. So ADHD is the common one we see, intellectual disability being the new word for mental retardation. They change it every few years as the old word becomes more of an insult. It used to be idiot before it was mentally retarded, and then people use idiot the wrong way, and so it just keeps changing names. Now it's known as an intellectual disability. Autism, also very common. And autism is a whole spectrum of disorders. There's plenty of autistic people walking around this campus. You can function with it. ADHD is more common because we have medical treatments for it. And when you receive the right treatment, you can function normally again. These are the ones that are commonly abused and mistreated. And when you're talking about designer drugs, street drugs, these are the drugs that are being synthesized. This is your Breaking Bad chemistry, methamphetamine. So again, we look at our disorders, know what we knew. Major depressive disorder, absolutely needs medication, right? If it gets severe enough. Alcohol abuse, social phobias, specific phobias, these are the ones that can do okay with just psychotherapy usually. Conduct disorder, oppositional defiant disorder, intermittent exposure disorder, these are your bad kids. Drug abuse, ADHD 7.8% usually, and then PTSD coming in strong. So a lot of anxiety, a lot of depression. So caveats in dealing with psychiatry, if you give two people the same blood pressure medicine, it's going to lower both of their blood pressures. Not true in psychiatry. No two patients are the same, which is pretty much true with everybody, but also no two cases of the same disorder are the same. It's not like two people have the same blood pressure, two people have the same depression. No, every case of depression is unique. Everybody has a different set of psychosocial circumstances under which their depression envelops. No two patients will react the same way to the same medication. Zoloft in me is different from Zoloft in you. There's no prediction on whether or not Zoloft will work or not work. You just have to try it. And when you're talking about like blood pressure medicines, you can switch freely between one beta blocker to another beta blocker and still maintain the same effect because it's in the same drug class. Not true with psychiatry. Each SSRI works completely differently to the person. So typically, you just have to guess. You start with one that you think might work, and if it doesn't, you try another and you try another, and it can be a very long, labor-intensive process. And a lot of students will give up on it before they've given it a fair try. But it takes time and it takes support. So our top prescriptions again, benzos, SSRIs, a lot of antidepressant drugs, anti-anxiety drugs, antipsychotic medications, some stimulants, Adderall, Vyvanse, Ritalin, Concerta. So SSRIs, selective serotonin reuptake inhibitors. These actually work by increasing the duration that serotonin is allowed to work in the synapse. And there's a whole brain chemistry theory about how all the neurotransmitters work. When you really get down to it, we don't know why serotonin does and does not work. We just don't. We know what it does, we don't know why it does that. When you're talking about previous generations of antidepressants, though, like this tricyclic antidepressants, they were actually pretty toxic, they had some pretty harmful side effects, and an overdose could kill you, which is not something you want to give a suicidal person. SSRIs, very safe. You can overdose on these all day long, and you might get sick, but it won't kill you. Problem is, though, it takes 6 to 8 weeks to work. Not to get into your system, it gets into your system immediately, but in order to actually start treating the depression, it takes 6 to 8 weeks just to even see if it's working. So if you give it 4 weeks and quit, you still haven't given it a fair shake. And a lot of people who start to experience the bad side effects before the good side effects tend to quit their medication early. So we see the common examples of these we've probably heard of. Prozac, probably the big one. Sertraline, #1 prescribed. Celexa, very common. Lexapro is one of the newer ones, and it's actually it's said to be a little more efficacious than the other ones, a little better at treating anxiety, a little less side effects, and you see it's just the S enantiomer of citalopram, same thing, more pure, if you will. And then Paxil, that was an old one, used to treat anxiety. It's fallen out of favor because it does have side effects. So SSRIs treat a wide number of things, many different indications. Major depression being the obvious one. Also, your phobias, your panic disorders. People taking this will have fewer panic attacks in a month. They'll be able to cope with the world better. Eating disorders can be treated with SSRIs, so your anorexics and bulimics, which exist, but of course hardly ever seek treatment because people are supposed to look that thin. OCD, PTSD, good treatments. Generalized anxiety disorder. They're also used for some other off-label purposes. They've been shown to aid in stroke and heart attack recovery, and so probably not our college population. But they do have positive effects. One of the biggest predictors of whether or not you'll die from a heart attack is whether or not you become depressed in the first 6 months after it. If you don't become depressed, you're more likely to live longer after your heart attack. Premature ejaculation. This is actually one of the side effects of SSRIs is sexual dysfunction. number one reason men stop taking them, present in about 70% of people who take them. And it's not something they'll tell you about unless you specifically ask about it, of course. But very common. Major side effects are just stomach upset. And you'll see these on every drug. Every drug causes headache. Every drug causes nausea, vomiting, diarrhea, constipation. The autonomic and sexual dysfunction, I tell people sometimes it makes you feel like a Superman in the bedroom. And that's actually a good reason to take it, right? Guys tend to like that part. Increased risk of suicide in populations under 25 years old. This was shown in a few studies. It's really inconclusive. The biggest theory is that you're so depressed you can't kill yourself, and as you get better, you're still depressed, but you actually have the energy to kill yourself now. That's the theory. All antidepressants carry that same black box warning, though. Not just SSRIs, but all the antidepressants carry that black box warning. If somebody stops taking their medication immediately, they'll get sick. Serotonin withdrawal syndrome, sudden withdrawal syndrome. This happens a lot of times. They need to decrease their dose gradually over the course of a few weeks. Best to do it under doctor's supervision, especially because the symptoms after the withdrawal are going to be worse than when you first started. You're going to have rebound, anxiety, and depression. Also, they can send bipolar people into mania. So bipolar, manic depressive, sometimes you're manic, sometimes you're depressive. These don't treat bipolar depression. If you do, it'll just spin them off into mania. Sometimes people don't know they're bipolar until they take one of these and it sends them into mania. So these are only for major depression, unipolar depression, not bipolar depression. Some of the minor side effects you hear about, headache, dizziness, drowsiness, or insomnia. Who knows? Some people it makes awake, some people it makes sleepy. Changes in dreams, changes in appetite, usually weight loss, so not always a bad thing. It's important that these aren't really prescribed with any other serotonergic drugs without a doctor's recommendation, because serotonin syndrome will make you sick. It will send you to a hospital. If you have too much serotonin in your body, it'll cause hyperthermia, hypertonicity. You can die from it. So a lot of over-the-counter supplements like St. John's worts, that's a serotonergic agent, and you have no idea how much of it is in that vitamin because nobody has to tell you. So a lot of people overdose on St. John's wort and their antidepressant and end up in the emergency room. Newer class of SSRIs are SNRIs, serotonin and norepinephrine reuptake inhibitors. So now we're affecting two of our neurotransmitters instead of just one. These are newer. They are believed to work a little better. They're slightly better. They're actually gaining popularity. We see these moving up the list. Good examples of these: Cymbalta, Effexor, Mystique is a newer one. But since we're triggering both the serotonin and the norepinephrine, we've increased our risk of side effects as well. We have all the serotonin ones plus the now norepinephrine ones. These are used to treat depression mostly, also anxiety, your phobias, your panics. These also have indications in treating neuropathic pain, like in fibromyalgia. And fibromyalgia is a whole other discussion, except that antidepressants can help cure it, especially Cymbalta. Cymbalta is indicated to treat that fibromyalgia. So we have all of the SSRI side effects, plus a little added liver toxicity, plus a risk of high blood pressure. Contraindications, if you have all these old people diseases. If you have eating disorders, it's contraindicated because it will make you stop eating. If you're already anorexic, you don't want to take a pill that's going to make you thinner. Loss of appetite, weight loss, insomnia, urinary retention. Feel free to stop me if I'm going too fast. So bupropion, also known as Wellbutrin or Zyban, it's sold as an adjunct to antidepressant medications and as a way to stop smoking. Zyban, stop smoking, right? So this is a norepinephrine dopamine reuptake inhibitor. We totally ignore the serotonin part and we hit the two neurotransmitters, norepinephrine and dopamine. It's an atypical antidepressant. There's not much on the market like it. It works synergistically when prescribed with the SSRI. They potentiate the effects. So this is really only indicated for major depression and smoking, typically as an adjunct. People have used it to try to treat ADHD and sexual dysfunction, especially the sexual dysfunction caused by SSRIs. It helps offset it a little bit. It's used to treat obesity and weight loss because it can cause the weight loss. Also, it can be added to mood stabilizers to help treat bipolar disorder. So this is one that's actually pretty common. Major side effects are insomnia, headache, seizures. This is one that epileptics aren't allowed to take, because it actually lowers your seizure threshold. And so the other things that might cause seizures, things like alcohol, benzodiazepines, you're up in your odds of having a seizure. Trazodone, another very unique antidepressant. This one actually has a very short half-life. It was originally sold as an antidepressant, but they realized it made people too sleepy to be able to function during the day. But if you take it at bedtime, it helps you sleep through the night. So a lot of times this is prescribed as a non-addictive sleep aid. It's used to treat insomnia. None of the addictive or abuse potentials like the other benzos that people take to help them sleep. And it's also relatively safe in overdoses, so you don't have to worry about people overdosing on their sleep pills. So insomnia, anxiety, depression. Also has been used to treat a slew of other things. Erectile dysfunction, because one of the side effects of this is actually priapism. You ever seen the Viagra commercial? If it doesn't go away within 4 hours, call your doctor. This drug causes that too. So it's good if you're having the sexual dysfunction from an SSRI. Otherwise, it's something to look out for. This can cause cardiac arrhythmias, possible liver toxicity. Again, contraindicated in bipolar disorder because we can trigger that. It's also metabolized in the liver by some of the same enzymes as grapefruit juice. A lot of things are actually. So if you're drinking grapefruit juice, ask your doctor or your pharmacist if it's interacting with your medication, because it alters the way things are dissolved in the liver. It can cause nightmares like most sleep medicines can. Also the trazodone hangover. This essentially, it's a hangover without any of the fun of being drunk. You wake up the next morning and you just feel miserable, like you got hit by a truck. And so a lot of people will stop taking this pretty quickly, but if you give it a few days, it'll go away. It'll completely go away. So benzodiazepines are the big worry, right? These are the things that are overprescribed for anxiety that everybody's taking and sharing. They work on the same receptor as alcohol and barbiturates. So just like alcohol, if you drink too much, it'll send you into a coma and kill you. Just like if you overdose on phenobarbital, it'll send you into a coma and kill you. If you overdose on these, it'll send you into a coma and kill you. Especially when you mix them together. Drug overdoses nowadays aren't because people are taking too much of one thing, it's because they're mixing wrong. That's what the students will tell you, is that they mixed wrong. They have Skittles parties where they mix them all in a bag. It's how Whitney Houston and Heath Ledger and all the other celebrities have died of drug overdoses. It's not because of one thing, it's because they're mixing wrong. And this is something you don't need to mix. This does have, it's really effective for anxiety, for panic attacks. So let's say somebody's about to get on an airplane, prescribe them 1 and they'll make it to their destination safely. Prescribe them 30 and they'll share it with all their friends. Also, if you go to the emergency room with a panic attack, when you're having a panic attack, it feels like a heart attack. You go to the emergency room, you're scared, you're worried. It's a lot easier for an ER doctor to give you one of these than set you up with a therapist appointment. So it happens a lot. That's why they're so overprescribed. These are actually used as sedatives as well. Anybody heard of Versed? They give it to you for dental procedures, colonoscopies. Not only does it help put you to sleep, but it helps you forget whatever the bad thing they're doing to you is. It helps you forget the procedure. Causes this short-term amnesia. There's actually a ton of different benzodiazepines. Some are short-acting, some are long-acting. So the long-acting ones have slightly less abuse potential because it takes longer to get into and out of your system. The short-acting ones, like Xanax, are the ones that get really abused. Ativan, Rohypnol, one of the many date-rape drugs. Klonopin, Valium was one of the old ones from the 70s. Mommy's Little Helper. Benzodiazepines, like that one. So, especially with panic disorders, this will treat an acute panic disorder. If you're having 6 panic attacks a month, give them 6 pills, and it's fine. As long as the patient knows to only take them when they need them. If the patient understands that, they don't have a problem. Not every patient gets addicted to these medications. Some patients really like the way it feels, though, and they keep taking more and more and more. You can also build up a tolerance to these just like alcohol, so it takes more and more to get the same effect. Also, the withdrawal of these is very severe, just like alcohol. Alcohol withdrawal will kill you, if you didn't know. Heroin withdrawal, very unpleasant. Cocaine withdrawal, very unpleasant. Alcohol withdrawal will kill you. These These are used for alcohol withdrawal, though, because like I said, they work on the same receptor, right? So we give them the short-acting ones like Xanax, usually Ativan. It's part of the detox protocol, they call it, and it helps prevent all the seizures and bad side effects occurring from alcohol withdrawal. You do this in the hospital in a very monitored, close setting. You only give them as much as they need to treat the symptoms, and as soon as they're done with detox, they're off it. No more. So in a medical setting, these are very useful. Like we said, they cause sedation and amnesia. Some people give them as muscle relaxants. I probably wouldn't do that. Some people use them to tranquilize patients, especially in the psychiatric hospitals, places where patients just throw fits. This is one of the things that go into that cocktail to put them to sleep. Major side effects: abuse, dependence, tolerance, withdrawal syndromes, because like we said, this can be pretty severe. They can cause drowsiness, dizziness, so just like alcohol, you don't want to drive while under the influence of these. You hear all the commercials about DUIs, you don't hear anything about BUIs, or I guess it would be DUB, excuse me. These do cause depression. They're depressants, just like alcohol. If you have depression, it will send you further into depression. Just like drinking alcohol doesn't cure major depression, taking benzos does not treat the anxiety associated with your depression. And they do cause respiratory depression, coma, death. And then, of course, all the minor things that occur with most of the drugs. Contraindicated in respiratory diseases because it does cause that respiratory depression. An exception to that, though, is in the ICU setting. Usually, if you're going to intubate somebody, you want them to be asleep for the duration of that. So you sedate them with benzodiazepines. Contraindicated in major depression, or if there's any history of substance abuse, because all the studies have shown if you abuse once, you're going to abuse again. That's not a habit or a behavior that goes away when you give them a different medication. So again, these things are being prescribed to the wrong people. These actually have antidotes, and a lot of EMTs carry them. It's a very fast-acting antidote. Within 1 or 2 minutes, they're awake again. It's useful in treating overdoses. It's also useful for reversing that medical sedation used during procedures. If they're benzodependent, though, if they've had them in their system a long time, it can trigger that immediate withdrawal. So not everybody should just get this every time they get high, and you want them to stop. Buspar is another anxiolytic, and this is actually a good choice for long-term treatment because it doesn't have the same abuse, dependence, withdrawal symptoms. It works on a very unique mechanism: serotonin activator, dopamine blocker, no risk, very mild side effect profile, very well tolerated. A lot of people think of this drug as a placebo just because it's so mild, and there's a common misconception out there that it is a placebo because it's so mild. In reality, though, it is just as effective as benzodiazepines in treating anxiety. The difference is if they've ever had a benzo, they're not going to get that same high. They're not going to get that quick calm, that sedation that they're looking for. It's not going to treat their anxiety the same way. They're not going to like it. So this is useful if you start a person on an anti-anxiety medication. It's not a substitute for benzodiazepines. So the only really indication for this is generalized anxiety disorder. Like we said, it's pretty common. It's often used as an adjunct when treating major depression, adjunct in alcohol withdrawal to help with some of that anxiety. Traumatic brain injury. That's something that's becoming more common with the last decade of wars. A lot of people get hit in the head when they blow up. It's a really horrible disease. This has shown evidence to help that, and there's currently a major study underway to help show those positive effects in larger population settings. And like I said, people sometimes prescribe this as a placebo. They think of it as a placebo. Really, a placebo is a very broad term. When you give somebody antibiotics for a viral infection, it's a placebo. You know medically it's not going to help, but you feel better knowing your kid got medicine for taking him to the doctor for his earache, right? Everybody does. If you didn't get the medicine you want, you go to a different doctor. If you went to the ER with the sprained ankle and they didn't x-ray your ankle, you'd feel pretty cheated, right? You do these things just for placebo effects. Major side effects, just dizziness, drowsiness, headache. So again, really minor. Even the worst things that can happen to you are very minor. Insomnia, depression, your usual stomach upset, nausea, vomiting, diarrhea, constipation. And then stimulants, the uppers. These actually work through a number of different mechanisms. They hit all the neurotransmitters we talked about, plus they help release the norepinephrine and adrenaline throughout the body to give you that kind of fight or flight feeling. on the go. They cause increased alertness, awareness, wakefulness, endurance, productivity, motivation, decreased perception for the need to eat and sleep. People don't eat, they don't sleep when they're taking these. They also cause euphoria. These are especially prevalent in the people who don't actually have ADHD. ADHD is actually a deficit, and whenever you give stimulants to a person with ADHD, they become normal. They don't get these same highs, they just become normal. That's how you can tell if a student really needs their ADHD. It actually calms the hyperactivity. It doesn't make them more hyper, more vigilant and shaky, it makes them less so. There's a couple theories as to how ADHD works. The best way to describe it is if you look at a tree and you can see all the leaves, right? But you don't literally see all the leaves. You only notice one or two specific ones. Well, if a person with ADHD looks at those leaves, they see all the leaves. Their brain can't sort out which one's important and which one's not. So they're quick to look away and find something else that can hold their focus. One of the best ways to describe it. So, attention deficit, hyperactivity, and impulsivity. Attention deficit, they're easily distracted. They can't focus on just one task. They tend to jump around, leave things uncompleted sometimes. They're bored unless they're doing something enjoyable. There's also a component to this called hyperfocus. When you set these people on something that they really enjoy, they will sit there and do it for hours and hours and hours at a time. Like play video games. And so parents will say, my kid doesn't have ADHD, plays the video games all day. Well, no, that's actually a side effect of ADHD. If they find something that can stimulate them in the right way, they'll do it. They have difficulty completing their assignments, losing things, not listening when they're spoken to, difficulty processing information quickly and accurately. You talk to them, ask them to do an assignment, they didn't get it the first time. You got to repeat it to them. They struggle just to follow the most basic instructions. Hyperactivity, we see this more in children. Usually this is something that they grow out of as they reach adult age. The attention deficit remains. The hyperactivity tends to go away as you get older. Fidgeting, talking nonstop, difficulty doing the quiet things. They can't stay quiet. Impulsivity. This is also a side effect. Very impatient people who blurt out inappropriate things at inappropriate times. They act without regard to the consequences. Why did you do that? I don't know. It seemed like a good idea at the time. They often interrupt other people. They butt into conversations, interrupt things other people are doing just because they have something important to say. So stimulants. These are the legal ones we talk about. These are some of the street ones. So amphetamine, Adderall, dextroamphetamine, lisdesamphetamine. And methylphenidate is a derivative of amphetamine, known by the names Adderall, Dexedrine, Vyvanse, Ritalin, Concerta. Caffeine, actually the most widely used psychoactive medication in the world. It's not prescription. Over 90% of Americans use caffeine daily. It acts as a stimulant. It helps you stay awake. It helps you stay focused. That's what we're looking for when we get our morning coffee, right? Nicotine, people smoke for these same reasons. Ephedrine is something that they used to put in weight loss herbal supplements from the ephedra plant because it does decrease that need to eat. And then Sudafed. And this, of course, can be used to make the meth, so that's why it's now more heavily regulated than firearms. Cocaine, known by a ton of different names. Y'all can probably create some of your own. Methamphetamine, meth, crank, speed, ice, crystal. Somebody's asking you where to get ice. They're not talking about the cafeteria. Ecstasy is a stimulant derivative. Bath salts. Has anybody heard of these? These will kill you. In general, methamphetamine is pretty toxic to your brain. It will kill your neurons. It doesn't just stimulate them and then let them go back to sleep. It will kill them. Bath salts will kill you in a month.
So what do they do with bath salts? Are they snort them?
You snort them. You can inject them or smoke them. Most of the people just snort them.
And these are over-the-counter bath salts that you put in your bath.
They're sold as not for human consumption, so they don't get regulated by the FDA. They're usually sold as plant food at $30, $50 a gram.
Yeah, it's not like the Epsom salts. It's
No, it's not like
that's the street
bath
name.
salts you use.
That's just the
Yeah.
Right. This is the chemical name. It actually comes from a plant called the khat plant, K-H-A-T. It's really common in the Middle East, Africa. Doesn't really grow over here, but over there people chew it like you smoke cigarettes. Everybody chews it every day like you drink coffee. It's just naturally occurring. The reason that you have all these, what they call designer drugs, is because you make tests to test for them, so you have to design the drug to evade the test. A drug will come out, and then it usually takes a few years for them to actually develop a routine test to find out whether or not they're taking that drug. Then they invent a new designer drug. That's how methamphetamine originated, that's how these bath salts originated, that's how ecstasy originated. They're trying to look for ways to outsmart the tests. And so there's always going to be designer drugs, there's always going to be derivatives of these amphetamines being used for illegal purposes. The problem is they're getting more and more toxic as you exhaust your options. All the easy ones have been found, right? Anybody ever heard of crocodile? That's another one they made a big news story about. It's like a heroin substitute, but it causes your skin to necrose like crocodile skin. It was a big thing on the news, and it's just how crazy people are to get high, but that's what you do because they can't test for it. It's the only way to legally take these drugs. So stimulants, they're actually indicated for ADHD and narcolepsy. People with sleep disorders who need to stay awake during the day, don't want them to fall asleep when driving the car. Also, Sudafed, the nasal decongestant, right? Also, traumatic brain injury. This is one of the major uses for stimulants nowadays. This is one of the major, one of the major treatments for traumatic brain injury being stimulants. So you see this a lot on the military side of things. Traumatic brain injury, they have all those ADHD symptoms. They can't maintain focus. They get extremely frustrated. Can you imagine going from being able to drive a car and everything to being just a mess? Treatment-resistant depression. Sometimes they think if you give them a stimulant, it'll perk them up. It's not usually recommended, although I guess it kind of works. People used to take these pretty regularly back in the day for weight loss. You just take your amphetamine and it makes you lose weight because it makes you stop eating. And it was effective as a weight loss thing. It's just too addictive to let people continue using it that way. That's why it's so heavily regulated by the FDA. And people do use this to maintain alertness, especially certain military organizations, special forces. If they've got a 24-hour operation, they'll feed these people a couple of amphetamines before they drop them off. It's essential to the job. No, it's not healthy, but neither is going around killing people in the dark. You do what you can. And of course, for performance enhancement, that's what most of our college students are using it for, right? Everybody on this campus, if you gave them Adderall, their test scores would go up. They work on everybody. They will make everybody on this campus smarter, right? They work. But we try to regulate them so that only the students who really need them have access to them so that the other ones don't become addicted. Is that news? Or?
No, we're looking for ways to raise test scores.
Yeah, now
you
know.
No, it worked. It was on the drinking water. So caffeine, like we said, is the most widely used psychoactive drug in the world. 90% of Americans use it. Cocaine was actually first invented as an anesthetic. It's one of the first stimulants ever derived. Not only does it create analgesia, it kills the nerves, it also decreases bleeding. It constricts the blood vessels, so when you're pulling somebody's tooth, not only does it not hurt, but it doesn't bleed everywhere, which in the mid-1800s was a pretty big medical advancement. Even in modern days, in some places, it's used for dental surgery, but there's enough alternatives. People are trying to veer away from it. And then, of course, we talked about how recreational users will create the designer stimulants to help evade their drug tests. Major side effects of these being, of course, cardiovascular side effects, heart attack, stroke, especially an overdose. People will use cocaine, overdose on it, have a heart attack at 30 years old, have a stroke, end up in the ICU, die, just because they overdosed on these things. Adderall has been pretty heavily studied. It doesn't cause these effects in normal people in normal doses. So as long as you take it as prescribed, there's no risk of this. They do, however, carry the same abuse, dependence, tolerance, addiction, withdrawal. They do cause psychosis. That's one of the major problems with things like ecstasy and bath salts and methamphetamine. People go crazy on them. It makes you crazy. The neurotoxicity, it will kill your brain cells. Has anybody ever seen meth mouth? First time I saw it, I didn't know what it was. It was in a diabetic patient of mine, and I'm like, you must not brush your teeth. I've never seen the blood sugar do that before. But no, it'll just rot your teeth out, turn them black. And then, of course, you crash after use. When you're on something like cocaine for a few days, when you come off it, you crash. you actually end up with worse depression, worse anxiety than you started with. With things like Adderall being prescribed medically, it's usually not that big a deal. It's usually not as severe, I should say. What they tell you to do is maybe take a drug holiday on the weekends or over the summers. So that way it helps clean out your system, helps you become less addicted to it, helps you become less tolerant to it. So when you do start reusing again, when school starts back up, it is more effective. You can use a lower dose. Some of the minor side effects we expect, right? Insomnia, weight loss. It's actually causes people to grind their teeth, so another dental problem. Dry mouth, high blood pressure, tremor, difficulty urinating. Obviously contraindicated in people with pre-existing heart problems. Also with people with other types of mental illnesses, because this can trigger some of the bad effects like psychosis. People with a history of drug abuse, of course, should never be given addictive drugs. And the last one we'll talk about is antipsychotic medications, because these are very heavily prescribed. These are often used as mood stabilizers, as adjuncts to antidepressant therapy nowadays. Have you seen the commercials, ask your doctor about Abilify if your depression's not being treated effectively? That's an antipsychotic medication, and it's really toxic. I wouldn't advise anybody take that for their depression, unless I work for that company that sells it. These are also known as neuroleptics, also known as tranquilizers. These were the original tranquilizers. Before barbiturates came around, barbiturates are now known as tranquilizers. These are the original tranquilizers, though. They actually come in two types. There's what they call the first generation and second generation of antipsychotics. The typical and the atypical. The typical ones are better for your positive symptoms of schizophrenia and psychosis. We'll talk about that in a minute. That's typically more of like the things you do, like hallucinate and have delusions. The negative symptoms are better treated by the atypical, and those are usually your deficit symptoms, like you don't talk a lot, you don't show a lot of emotions, you tend to have a very blunt affect. These work by blocking dopamine receptors in the brain, but the atypicals work on both dopamine and serotonin, which is why they have a better range of effect. They also tend to be a little less toxic, a little better tolerated. Some of these that we may have heard of: Haldol, vitamin H in the hospital setting, Prolixin, Thorazine. These are all the ones you see advertised on TV: Abilify, Clozaril, Latudas like Prexa and Vega, Seroquel, Risperdal, Geodon. So a lot of these out. They're more popular nowadays. These are especially used to treat schizophrenia. And like I said, schizophrenia is the kind of thing that therapy doesn't help. You need to seek medical treatment for. And even like general practitioners will try to treat anxiety and depression. Nobody but psychiatrists treat schizophrenia because these drugs are so toxic and so dangerous. Schizoaffective disorder, and that's kind of when you have schizophrenia combined with a mood disorder like bipolar or depression. Bipolar disorder, these are used for as kind of mood stabilizers like lithium used to be. Lithium used to be very commonly prescribed. Now it's kind of fallen out of favor because it's very toxic. So this is used to help treat major depression that's treatment resistant, like we saw the Abilify and Psychiatric commercials for, and also to help treat some of the symptoms of autism. We also see these being prescribed a lot to demented patients in hospitals. Has anybody ever worked around people with Alzheimer's, perhaps? Sundowning dementia. Yeah, every night, demented people tend to go crazy. So you give them a little bit of Seroquel to help them through the night. And the next morning, they're fine again, and they don't remember anything from the night before. It's a really weird phenomenon. And then some people will just prescribe these for insomnia, just to help you sleep. And that's, of course, a very dangerous way to do it. They're much better drugs to use. So the positive and negative symptoms we talked about, this is typically how people present, because these are things you tend to notice about a person. They're having delusions, they're having hallucinations, disordered thoughts, disordered speech. Everything's jumbled. They talk in word salads, where they're just repeating words that have no sense in no specific order. This usually happens especially during the first psychotic break, and these actually respond very well to the antipsychotic medications. The negative symptoms really don't respond so well. The atypicals help with these a little bit, but not as much as we'd like. So even if somebody's schizophrenic being treated, you still see them with flat expression, not able to show emotion very much, not feeling very much emotion, poverty of speech, they don't talk a lot. Anhedonia, they don't find pleasure in anything. The things they used to find fun, they just don't find fun anymore. They don't participate in fun activities. And then, of course, the lack of motivation. I'm here, now what? Major side effects of antipsychotics. Extrapyramidal side effects. And this is things like restlessness, like, restless leg syndrome where you just can't sit still. This can be caused by antipsychotics. Dystonia, a muscle gets stiff, tight, locked down, and it won't relax. Parkinsonism, the signs of Parkinson's disease, tremors. Hyperprolactinemia. Prolactin is released based with dopamine, so when you block the dopamine, you release more prolactin, causes gynecomastia in men. That is men with breasts. This is the glandular breast tissue, not just fat. But they do start lactating. Men will lactate and also women will lactate. And when you're a psychotic woman who's now lactating, you believe you're pregnant with the Jesus child. Very common. Metabolic syndrome. These things will make you put on 50 pounds in a month. This is probably one of the biggest reasons people don't like to take them is because you gain so much weight. It will also take years off your life. It causes all the bad high cholesterol, hypertension, diabetes. So it's very important that they get these things monitored very frequently. Arrhythmias, there are some of them that will cause irregular heartbeats. Tardive dyskinesia. This is when you have the person who's just smacking their lips for no reason. Old people do it a lot because they are on some of the medications like this. This is especially true with the first generations like Haldol. It still exists in the second ones. And neuroleptic malignant syndrome. This is how people die. Blood pressure, heart rate instability, it goes through the roof, it bottoms, it goes through the roof, it bottoms. Nausea, vomiting, sweating, hyperthermia. Their body temperature goes way up. Muscle rigidity, they go into clonus, they lock down, and eventually they die if that's not treated. So this is something that they need to be monitored very heavily for. Usually if the schizophrenia is severe and they're using high enough dose of antipsychotics, they'll put them in the psychiatric hospital to start that dosing just to make sure that none of these bad side effects happen immediately. And then all the things that we said were major side effects of the other drugs are relatively minor compared to those. Nausea, vomiting, diarrhea, headaches, sedation, anxiety, constipation. So antipsychotics are pretty horrible medications. They're commonly prescribed, but they're actually really bad for you. Also, sudden discontinuation will lead to those withdrawal syndromes. Not only will it make you sick, it will drop you into psychosis. If you suddenly come off your drugs, you will enter psychosis. If you're going to come off it, you need to taper down, hopefully under the guidance of a doctor. The atypicals are usually better tolerated, so you're more likely to see those. And as toxic as they are, we still have to believe that it's better than being actively psychotic. That's the only reason you get anybody in medicine is when the benefits outweigh the risks. Historically, these were the people who just lived in an asylum for their entire lives. Now they're allowed to be functional members of society. At a big cost, sure, but it's still better than the alternative. So how can we help make sure that students are taking the medications they need? How do we make sure that they're receiving the medications they need and that they're being adherent and seeing their doctor like they should? End the shame and stigma of having a mental disorder. End the stigma. The number one barrier to providing mental illness, and I'm sure most of y'all probably already know this, is just the stigma. You don't want anyone else to know. If you tell somebody you have cancer, you get brownie points. Oh, you're so strong. If you tell somebody you have depression, they think it's a weakness. There's something wrong with you. If you tell somebody you're taking chemotherapy, wow, you must be brave. If you tell somebody you're taking an antidepressant, what's wrong with you? Again. And then, of course, if somebody were to tell you that they're stopping their chemotherapy, you'd think they were crazy. But when somebody tells you that they stopped taking their antidepressant, you should think, oh good, you must be better now. That's typically not the way it works. I would be more afraid of the person who said they stopped taking their medication. The perceived public stigma is much higher than the personal stigma. So it's not just that the students are afraid of taking the drugs, they're afraid that their friends might find out. In a survey of college students, only 23% of them would tell their best friend if they were diagnosed with a mental disorder. 70% of people wouldn't tell even their best friend if they had a psychiatric illness. On studies, the personal stigma seems to be the highest if you're young, male, not white, if you're an international student, if you're highly religious or from a poor family. I think these two are pretty common around us. In terms of the students who would seek help if they thought they had a psychiatric disorder, it's much higher if you target the programs to decrease the personal stigma. If you tell the person it's okay to have these problems, it's okay to take that medication. It's not a sign of weakness, it's a sign of strength. It's a sign that you know what you're doing. So how do we fight stigma? Provide information to the campus on just how common these are. 1 in 6 of y'all are taking antidepressant medications. Ask your friends. How important it is to get help. Spotlight some of the students, faculty, and staff who have achieved success living with a mental health condition to help fight stigma and offer hope. This would probably be a bigger culture shock around here than it would be in other places. It'd kind of be like the equivalent of coming out of the closet being gay, just so you have your fellow gay supporters, which is fine, but people are just going to look at you real funny. Host campus educational activities and campaigns that help combat the stigma. And this is something we can certainly do. Make our presence wider. Say, hey, it's okay to come talk to us. You know how you get people to see the psychiatrist in the military? Offer smoking cessation. The vast majority of soldiers overseas smoke all day because there's nothing left to do. Say, hey, come see your psychiatrist if you want to quit smoking before you go home. Okay. I'll go see you just to stop smoking. I'll go see you just because I'm having trouble sleeping. I'll go see you just because I'm about to change 12 hours worth of time zone. Simple special speakers to talk about mental health. Offer training for students, faculty, and staff to learn the facts about mental health. Fight the stigma where it lives. A lot of the faculty members will look at a student differently if they know they're on a psychiatric medication. A lot of the faculty members are scared to have people with a known psychiatric illness in their classrooms. Treat mental health conditions the same as you would any other physical health condition. It is just as disabling. It is just as likely to kill you in this age range. It's more likely to kill you in this age range, actually. These are very serious things. This will cause you to drop out of school faster than most other problems. So integrate the services and supports that exist around here. And I think we've already done a pretty good job at that, right? Trying to get everybody on the same page about what needs to be done, how we can expand our role in helping the students. The final thoughts I have, taking psychiatric medicines is not a sign of weakness, no more than taking any other type of blood pressure medication. Staying on your medication actually shows good insight and good judgment. It shows that you're actually a strong person and know what you're doing in life. I'd be more afraid, like I said, of the person who isn't taking their medication. More people than you think are taking the same medicines for the same reasons you are. These things are not rare. They're everywhere, but nobody wants to admit it. If you're doing well on your meds, stay on your meds. You know, if you're on a blood pressure medicine and it lowers your blood pressure, you think that's a good thing, I'll stay on this blood pressure medicine to keep my blood pressure low. If you send somebody on an antidepressant and their depression goes away, they stop taking it. It's like taking the duct tape off something after you duct taped it in place. It's going to fall right apart again. It doesn't work that way. You've got to keep taking your medicines. If it works, do it. If it's not working, see your doctor. There are so many alternatives out there, so many other drugs within the same class that can have the same benefits with different side effects. You can fix most of that. It just takes time. You have to give it a try. Don't be afraid to try new things. And of course, psychiatric medicines aren't forever. A lot of people think once I start, I can never go back. That's not true. Usually after about a year, your station in life changes, your situation changes, your job changes, your friends change, whatever the problem was causing such a severe disorder changes. So you can see about going off your medications, and of course this needs to be done slowly. If you suddenly come off it, you'll have the withdrawal symptoms and you'll have the sudden relapse. But if you do this with the doctor, you can wean off slowly, and you don't have to be this way forever. These are things I looked up. Any questions? Was it a lot?
A lot. But a good lot.
Very good.
Thank you so much. I really appreciate you being here and doing this for us. Does anybody have any questions? Anybody?
Where are you going to have these posted slideshows?
Wherever you post.